The Substance Abuse and Mental Health Services Administration, or SAMHSA, created the Wellness Initiative because people with mental and/or substance use disorders tend to die years earlier than the general population. Studies show this is mostly due to preventable and treatable conditions such as diabetes, heart disease, and cancer, which can be improved by healthy eating, increased physical activity, and smoking cessation. Focusing on health and wellness is particularly important for people with or at risk for mental and/or substance use disorders so they can live long, healthy lives. SAMHSA's goal is to help individuals, families, providers, and communities improve whole health outcomes. Keep listening to learn more about wellness and tips you can apply in your life.
Welcome to another episode of SAMHSA's Program to Achieve Wellness podcast series. We're excited to be part of SAMHSA's innovative initiative offering new and exciting information about alternative treatments for those experiencing mental health challenges and behavioral health providers. Today, we offer tips, tools, and resources about whole health and wellness approaches to chronic pain, particularly focusing on alternative, non-opioid treatments. Both speakers are trained in various alternative treatments, and more importantly, both have also experienced chronic pain and have found deep relief through alternative treatments. We're excited to share experiences, options, and some hope. Thank you for joining us today, and now each of our presenters will do an introduction.
I'm Jean Supin, founder of AlternativeBehavioralHealth.com, and I'm delighted to be participating in and supporting SAMHSA's Program to Achieve Wellness. Thanks, Kathy, for that introduction. Exploring alternative ways to address chronic pain is such an important and timely topic, and I'm honored to be invited to contribute. And Linda, it's also a joy to be doing this podcast with you, Linda Meyer, who has a wealth of experience and information. Let me start with just a little bit about me. First, I'm not a clinician or a provider. Instead, I help with systems and organizational change, especially when practices and agencies want to integrate alternatives into their service array in behavioral health. I have also been living with chronic pain for almost 40 years, since I ruptured several spinal discs when I was 19. Later, I'll talk more about my experience and how alternative treatments helped. But first, Linda, why don't you introduce yourself before we jump into the content?
Thanks, Jean. The experience I offer in this SAMHSA podcast about chronic pain is that I am someone who not only has achieved an understanding of how to support myself during the days of experiencing chronic pain, but also someone who had a very long and severe psychiatric crisis and is now working in the field to support others through their own journeys. I will share with the listeners some of my personal journey of how I struggled in the past and how I'm able to manage myself today with action plans that I developed for myself, utilizing peer support and the Wellness Recovery Action Plan. I will also share about my insight and how I share with others the thought process and the tools I use to understand and manage my chronic illness and pain.
As someone who also experiences chronic pain, I've learned a great deal from the personal journeys of others. Jean, would you share how you first became interested in alternative approaches to managing your chronic pain?
Sure. Thanks, Kathy. In my case, while technically my chronic pain was physical and centered around isolated parts of my body, specifically lower back and my left leg, I can definitely say at its peak it was horrible and debilitating and would cause me to cycle into feelings of hopelessness and despair. While I've never had a diagnosable mental health condition, I can say my chronic pain definitely interrupted my sleep, perpetually caused me to plan around it, messed with my head, messed with my mood and my optimism. I suffered both physically and emotionally. Let me very briefly summarize my pain and pain relief journey. I first experienced severe acute pain in my lower back and hips suddenly, like all of a sudden, when I was 19 and in college. For a couple of years, I dove into conventional treatment, steroid shots and physical therapy mostly, and nothing seemed to help. And I also never got a definitive diagnosis. I mean, this was the early 1980s, and no one ordered an MRI or other imaging tests besides some basic x-rays. So we were all kind of unsure about what was happening. At age 23, so after I got out of college, I backpacked around Europe for 3 months, and that actually changed a lot for me. First, I was walking everywhere those 3 months, so I was getting a ton of daily exercise and not sitting nearly as much as I had before. And I noticed my pain lessened dramatically. Plus, while on that trip, a friend in England introduced me to my very first yoga class, and that became life-changing. I've been practicing yoga now for 33 years, and I still practice at least several times a week. But back then, I still didn't have a proper diagnosis, and my injury and my pain remained. However, I learned that yoga and aerobic exercise could help keep it at bay most of the time. So throughout my 20s and 30s, I tried all sorts of things to spark more deep and real healing, more steroids, more physical therapy. I put orthotics in my shoes. I tried a zillion different exercise routines. I used a bunch of different pieces of equipment, and nothing seemed to help. One orthopedist even told me it was all in my head, and I had, quote, nervous women's disease. Needless to say, I immediately demanded my health records and walked out of his office, never to return. Interestingly, throughout all of that, though, I never took opioid pain meds. This was back in the 80s and early 1990s, so it wasn't offered. I just figured I had to keep it at bay best I could and grin and bear it. Finally, at age 35, I eventually got an MRI, which revealed that I did, in fact, have an old injury. We assumed it was when I was 19 and had ruptured 3 discs in my lumbar and sacral spine. At the time, though, at age 35, the injury was too old and the prognosis too iffy for surgery. But it really was nice to finally know definitively what was going on. And it was at about that same time I began to do a deep dive into alternative treatments.
Thanks, Jean. Linda, would you mind sharing a little bit more about your experience?
Yes, I can. It's so great that you were able to find those healing alternative treatments, Jean. Ironically, my psychiatric crisis was the result of medical professionals' inability to help me or diagnose the physical pain and struggles I was experiencing. This beginning developed into depression and was the first of over 27 hospitalizations in 5 years. I became traumatized in the psychiatric system of care because the medical clinicians were unable to help me, so they assumed it was a psychiatric condition, but boy, were they wrong. In the early years of my struggle, I experienced fevers, debilitating joint pain, memory and recall struggles, severe headaches, muscle pain, vision problems, mouth sores, stabbing chest pains, and severe tiredness. At that time, I was the mother of young children, and it not only became hard to manage myself physically, but it became very difficult to care for my newborn baby and toddlers. My experiences included not finding a remedy for my pain management, especially as it changed, not having control of my body and when it flares, doctors not being able to help me as I thought they should, being misdiagnosed and not trusting many doctors, side effects to medications, which caused more diagnoses, reoccurrences and flares of symptoms, and the challenge that no matter how much I plan, each day I will feel different, be unpredictable, and not have any control of my life. There was not only the physical and emotional toll of not feeling well, but also the fact that doctors could not diagnose why I was not feeling well, until many years later when I had a biopsy, and years later when I almost died from a massive saddle pulmonary embolism, after being released from an emergency room when they misdiagnosed my chest pain. Not understanding this led to subconsciously being re-traumatized and hypersensitive to many of my reminders of past trauma that I was totally unaware of until I became familiar with the WRAP, or the Wellness Recovery Action Plan. And I learned how to peel apart the onion of an experience to reveal true feelings and learn to manage my life more effectively. It's really very interesting. My professional work has helped me become more aware of another realization and transformation as I supported others working in a clinical psychiatric hospital in Philadelphia and now in my own center. The importance of sharing our experiences and helping others become aware of the mind-body-spirit connection has helped me find alternative treatments such as Reiki, meditation, and yoga.
Thank you, Linda. It'll be great to come back and talk more about what you learned and continue to share more about the mind-body-spirit connection and how these practices can be non-opioid alternatives to pain management. Jean?
Let me talk a bit more about that. So the mind-body-spirit connection is a key element of alternative treatments. The former U.S. Center for Complementary and Alternative Medicine, what's now called the National Center for Complementary and Integrative Health, they used to have a really good set of categories that I thought really described well the different types of alternative treatments. These descriptions are still available from the NCCIH. This categorization remains really helpful to me in understanding my options and options I suggest to others and what types of treatments might best work for different conditions. Plus, as with everything, each person's own unique experiences and conditions lend themselves to different and tailored interventions, so it's good to know your options. I'll describe the 5 categories, and while there's definitely some overlap and they're not, pure and clean categories, in general, they really are helpful. So category 1 includes alternative medical systems such as acupuncture / Chinese medicine, Ayurvedic medicine, and homeopathy. As the name of the category suggests, these are fully comprehensive medical systems, as broad-reaching in scope as our current Western system. Chinese medicine and acupuncture, for example, is 4,000 years old, with sophisticated anatomy, physiology, pathology, diagnosis, and treatment systems that have addressed every disease under the sun. While here in America, we typically look to acupuncture to alleviate pain, acupuncture and Chinese medicine offer so much more than just pain relief. Alternative medical systems, full-blown systems like acupuncture and Chinese medicine, homeopathy, and Ayurvedic, have been curing viruses, bacterial infections, inflammation, autoimmune disorders, mental health disorders, addictions, and a full array of anything that Western medicine has been addressing for a really long time. Elaborate evidence supporting classical Chinese medicine, for example, has existed for centuries in both China and Vietnam, and similar evidence for Ayurvedic medicine can be found in Indian texts and research. And even the British premier medical journal Lancet has a long history of publishing contemporary studies showing the success of homeopathy. In fact, homeopathy as a full system and a complementary system is an approved covered treatment in parts of Europe. So that's category 1. The second category includes mind-body interventions, things like biofeedback, brain gym, expressive arts, meditation, mindfulness, qigong, yoga. These interventions or practices help integrate the physical, mental, and emotional systems, and so that our whole system can operate in coherence and kind of return to a kind of coherent and fully integrated state of health and well-being. The third category are biologically based therapies, such as functional assessments, herbal medicine, nutrition, nutraceuticals. These all help with either specific disorders or help build and maintain overall health. Practitioners of these approaches will diagnose by figuring out what's missing or what's necessary for optimal health, and then prescribing specific remedies, medicines, nutritional changes, nutraceuticals, herbal remedies. And they are typically naturally occurring, and some are gentler to a person's system. The fourth category are manipulative and body-based methods, such as chiropractic, somatic movement, cranial sacral therapy, the body talk system. For these systems, these practitioners will make body adjustments or suggest specific body movements in order to facilitate healing. Sometimes the adjustments are obviously and directly related to a problem, like when a chiropractor pops a vertebra back into place. And sometimes the body-based method is much more subtle. In cranial sacral therapy, for example, a practitioner will place her hands gently on the side of someone's head or may not even touch the person's head, and through the most subtle of movements actually stimulate and move cerebral spinal fluid. The fifth category includes energy therapies such as Reiki, resonance repatterning, healing touch, other energy healings, light or sound therapies, matrix energetics. These therapies operate on the electromagnetic or quantum physics level, shifting electrical or energetic patterns in the body. These practices can seem odd because you don't necessarily really feel anything when it's happening. Yet afterwards, people often report very clear and distinct reductions in pain or other symptoms, even though they don't understand how it actually happened. There's also overlap between energy therapies and the electromagnetic and quantum physics components at play with acupuncture, neuropuncture, and homeopathy. So returning to my own chronic back pain, yoga is a mind-body intervention, and it's been great at keeping me strong and flexible and pretty much pain-free. Yet for me, my real healing came when I added to yoga, engaged with skilled providers of alternative medicine systems, namely Chinese medicine and homeopathy. And I used those and went to very skilled practitioners in those therapies. And I supplemented their deep healing work with other energy therapies and chiropractic and gradual diet changes. Those things combined helped me regain my health and freed me from pain. And then now to stay healthy, I still practice yoga and I still hike a lot.
Thank you so much for that. Linda, let's hear more from you now about your perspectives and what you found helpful.
Yoga and Reiki are great examples for me. As I reached out for more support for my own physical pain and feeling the difference Reiki, meditation, and yoga has helped me with, I've actually become a certified Reiki practitioner, and I continue to learn more about the holistic approach to heal not only myself but others. For years, I was stuck in the mindset of going to the doctor and following their plans for me, and it usually was that I was given a prescription for medication to help ease my physical or emotional symptoms. And in many ways, I was stuck in that mindset of doing what the doctors told me to do. And it wasn't until my psychiatric crisis that I learned to advocate for myself and learned that I needed something different. That journey of finally coming off psychiatric medications and learning more about myself was the defining moment of incredible spiritual changes. And I learned I could use my strengths as I did in that journey and began to look into the mind-body-spirit connection to help ease my struggles with physical chronic illness and pain. In the past, I just heard about alternative treatments such as spirituality, meditation, yoga, and Reiki, but I never actually reached out until I met a few people who helped me understand and helped me not be afraid of what I can't see or touch. Now, because of my past experiences, this was very hard to do because everything was black and white in my world, but I finally trusted myself and trusted others to help guide me in learning more. Prayer and meditation was the first I learned to help myself handle many of the struggles in my life. Prayer allows me to share my thoughts, and meditation allows me to listen. Both are simple to do, and I can do them anywhere or with a group with guided meditation. I find the benefits of prayer and meditation help me concentrate and focus while manifesting within myself the strength to help myself. I have found strengths of being intuitive, insightfulness, and empathic, which allows me to find more balance in my life as I handle what life throws at me. I realized I can concentrate more effectively, and I can use deep breathing meditation to reinforce the balance of my mind and allow myself to not focus on my pain or negative thoughts. Another alternative treatment that I use is yoga. Again, I knew nothing about it until I met a good friend who was a certified yoga instructor, and together we talked and shared the benefits of simple stretching and movement. I was excited when I realized many of the movements in yoga are what I used to do in high school and college as I stretched before my sports practices. And so I found the connection to myself again and began taking beginner yoga. Understanding how different movements and stretching affect my body, I could adapt them to where the pain was in my body. So whether I'm in my van or sitting watching TV, I can choose to help myself by doing some very simple, effective stretches to help ease my pain. As I continued to learn more about the mind-body connection, I reached out to someone for a spiritual session, and she gave me Reiki. Reiki is a Japanese technique for stress reduction and relaxation, and it promotes healing, and it's simple, natural, and safe method of spiritual healing and self-improvement that everyone can use. It is a life force energy to improve the health and quality of life, and it is a subtle energy that surrounds the flows and pathways, and this life force nourishes all the cells in our body. Strengthening this life force helps our body heal and remain healthy. Now again, I had no idea what this was, and yet the challenge for me was to just lay on the table and relax, but realize its effectiveness when I felt the results of my Reiki session. So I tapped into my strengths to conquer this and allowed the process to unfold, and I felt the difference. As I continue to take responsibility and find my own techniques that help me, I've integrated meditation and yoga into my own personal life, as well as offer this in my center. I also became a certified Reiki practitioner and continue to use this in my personal life and in my workshops to develop an environment that is positive, as well as send my healing energy to others. Any alternative choice of care is an action plan, and I stress this in my work as many go on developing their own way of feeling better and changing their existing tools to develop long-term strategies that are more effective and wellness-focused. Wellness is about understanding what is happening to us and making choices to help ourselves. There are many choices available for treating chronic pain, but sometimes people are not given choices beyond medications. I see more and more people reaching out for alternative care because of the distrust people are finding in the medical community.
Thank you, Linda. And now for some summarizing remarks from each of our presenters.
In my work, I offer a mini workshop based on SAMHSA's 8 dimensions of wellness, and together we discuss the strengths, weaknesses, and goals of each dimension, and this has truly been a life-changing workshop for everyone, including myself. Understanding the connection of these dimensions and how they integrate with each other can help someone understand themselves, as it did for me, and I believe sharing more of this can have an individual positive outcome on managing not only their pain, addictions, or mental health struggles, but their whole lifestyle. Many times, this support in the workshop with each other is crucial in giving someone hope as they learn in a no-judgment zone and create a comfort agreement. They learn how to support themselves and others in the workshop or groups, and they create and manage their own action plans, which they have power over, and almost everyone tells me they have never felt this in a traditional clinical relationship. As we know, sometimes others may not have the ability to take responsibility or advocate for themselves, or they struggle with how to learn and educate about their diagnoses. Some may find it difficult to learn about the side effects to meds or why they are having pain. Sometimes others can't communicate their needs, which is why a certified peer supporter working in the field is essential in giving others hope.
I know we've covered a lot of information in this podcast, and I hope it was helpful. Yet I've found the best way to learn about alternative treatments sometimes is to just try one. Any of the listeners, you can find good alternative providers typically by asking friends, looking at a local alternative health magazine or website, asking around at a health food store or at a spa. Your physician or other provider may also know some good alternative providers, and then just try something. A good alternative provider will take the time to explain what she's doing and what you can expect. A good provider will meet you right where you are in terms of what you're bringing to that session, any symptoms, a disorder, whatever it is you're bringing. A good provider will handle with grace any skepticism you might have and will be realistic about what she thinks she can offer. And if a good provider makes you feel comfortable in those ways, even if you're not familiar with the treatment she's offering, you can give it a try and see what you think.
Jean and Linda, thank you so much for joining us today. And everyone, thank you for joining us for this podcast from SAMHSA's Programs to Achieve Wellness.